What is basal cell skin cancer recurrence? Have you ever wondered what happens when basal cell carcinoma comes back after treatment? Basal cell skin cancer recurrence refers to the return of basal cell carcinoma, often called BCC, at the same site or nearby after it has been treated and initially removed. BCC is the most common form of skin cancer, typically appearing on areas of the skin that get a lot of sun, like the head and neck. While it usually grows slowly and rarely spreads to other parts of the body, it does have a tendency to come back locally after treatment. The rates of recurrence can vary based on several factors, including the type of treatment used, the characteristics of the tumor, and the patient's medical history. For example, after surgical removal, including a technique called Mohs micrographic surgery, which removes cancerous tissue layer by layer, the recurrence rates for BCC can range from about 5% to 15%. If a patient has had BCC before, the chances of it coming back, known as recurrent BCC, can be higher, with rates reported to be around 17% or even more. For those experiencing their first occurrence of BCC, the recurrence rates are generally lower, around 9% or less. It is important to note that the risk of recurrence tends to increase over time. Studies show that cumulative recurrence rates can be about 3% at 1 year, 12% at 3 years, and up to 22% at 5 years after treatment. Certain factors can increase the likelihood of BCC returning, such as the size and location of the tumor, especially if it is on the head or neck. Aggressive subtypes of BCC and incomplete removal during surgery can also raise the risk. Additionally, individuals with weakened immune systems, such as those with chronic lymphocytic leukemia, may face higher recurrence rates. When BCC does come back, management usually involves repeat surgery, often using Mohs surgery again, which is known for its high cure rates. In some cases, radiotherapy might be considered, especially if surgery is not an option. Since BCC can recur months or even years after the initial treatment, ongoing dermatologic surveillance is crucial. Regular skin examinations help catch any recurrences early, which can lead to better outcomes. Preventive measures, like using sunscreen and avoiding excessive sun exposure, are also vital in reducing the risk of new skin cancers. In summary, basal cell skin cancer recurrence is when BCC reappears after treatment, with rates influenced by various tumor and patient factors. Effective treatment and regular follow-up are essential for managing this common skin cancer and maintaining healthy skin. Always consult a healthcare professional for personalized advice and treatment options.